After a predicted surge following the holidays, COVID-19 and the Omicron variant has seen significant drops. Here to share if that number will continue to go down and what we should expect in the near future is Dr. Michael Sweat. He's leading MUSC's COVID-19 Epidemiology Intelligence Project. He's also professor and director of the MUSC Center for Global Health. Thank you, sir, for being with us today.
My pleasure.
So we're hearing a lot of optimism from experts out there. What is your estimation as far as the Omicron variant and if we're going to be seeing further dips in numbers?
Yes, I do think we're going to be seeing further dips. Currently, we are having about 145 cases per 100,000, and on January 15th, we hit the peak in the Charleston area of 416 cases per 100,000. That's a very large number. So we're about halfway down from that peak in a matter of weeks. I do anticipate, based on what we see in other locations that have preceded our epidemic, we're going to continue to see those drops occurring. And if I had to look to the future in the short term, I would guess that we're going to see this get very low for quite some time. And one reason for that is these outbreaks occurred, and this is unusual, occurred across the country simultaneously. They shifted by a few weeks here and there, so currently the Midwest and the West are having their peaks coming on. But they're close together in time, which means a lot of people will have had exposure and immunity all at once. That makes it a lot harder for the virus to spread.
So would you say that we have now started to enter or will soon enter the endemic stage of the pandemic?
I wouldn't go that far. I think endemic is something we hope for. It may happen. The risk is we're likely to see other variants come along. And the other risk is immunity doesn't last forever, either from a vaccination or from an infection. We know well now that it wanes over time. So as time passes, immunity is going to decline. The best way to get it up is through vaccination. So I envision we'll see booster shots in the future. So yeah, we're not going to be at the total end game, but we're moving in the right direction.
That's good to hear.
Sorry?
That is good to hear. If I could also ask you this quick question, are you surprised at all by those numbers, considering the fact that Omicron was so very transmissible? A lot of people caught the Omicron variant, even though they had been vaccinated and boosted. So the fact that we are seeing such a dip in numbers just a few weeks after the holidays have ended, does this surprise you?
Not really, because the fact that it was so transmissible and it spread so rapidly through social networks out there means it saturated the available people it could infect relatively rapidly. And as well, we saw the same pattern in South Africa where it was originally detected, and also in the UK and Denmark and other places that had earlier outbreaks. This very steep increase followed by a very steep decline. So it's not that surprising that we're seeing that.
I see. Yeah. So what you were saying is that South Africa was somewhat of a bellwether for what we should expect here in this country. And you were saying that the fact that people still need to get vaccinated. So I want to talk a bit about those practices that we really should keep up with in the future months, because you say that there are going to be other variants coming up and it's a little, I guess, predictably unpredictable.
Indeed, it's predictably unpredictable. We may luck out and this will drop down real low and we won't have other variants. But the history suggests that we are going to see other variants going forward. But I want to stress that even though things have come down right now and are likely to continue to come down, they're at a very high level right now. We are currently at about the transmission level that we saw at the peak of our last wave in September. So I wouldn't drop my prevention efforts right now, but I think you could probably lighten up in the weeks ahead when we get to a lower level. So indeed, there's a lot of uncertainty as we go into the future.
Well, we certainly saw that put into practice at some of these football games that folks were required to wear masks. A lot of them were not wearing masks, but you say that maybe some of those restrictions can start to ease in the next few weeks, couple of months. How soon?
Yeah, I would think that within weeks, literally, we're going to see much lower numbers. Time will tell, but it's likely that in the weeks ahead, by the springtime, I think we're going to see lower levels. But it's still important to get vaccinated.
Yeah.
And to get boosters. Boosters are one of the most protective things. So having 2 doses of the vaccine a year and a half ago doesn't give you that much resistance to the virus right now, particularly in terms of getting very sick and ending up in the hospital. But boosters really bring that number back up. So we're gonna be thinking about boosters going into the future.
Boosters, very good. Dr. Sweat, thank you very much for joining us today. We appreciate your
My pleasure.
information.
Thank you.
We're back after this.